Hello, my name's Chelsea. I'm a physical therapist, coach, and trainer. I'm going to go over some criteria and tests that I use to help people get back into running after knee injuries. A lot of these can be applied to low back, hip, and ankle injuries as well. In terms of strength and control, I like to see that the individual can perform good quality single leg squats and bilateral landings. When it comes to return to running, it's all about gradually exposing your body to load and stress. So we call this graded exposure. By gradually exposing yourself to load and stress, you're allowing your body the time that it needs to respond to that and adapt so that it can get stronger. You're also allowing yourself time to properly assess to make sure that your body is able to tolerate that amount of stress or load. If you do notice that your knee is starting to get more and more sore, more and more stiff, or there's swelling, that's just an indicator that it could have been too much stress for the knee, and maybe you need to drop down a level in that return to run protocol that you were provided. Or maybe it means that you need to go back to some of the basics like building up general strength or tolerance to plyometric exercise. For return to run, we'll want the knee to have minimal pain, minimal swelling, and full range of motion. Full range of motion of the knee is 120 degrees of flexion or bending and 0 degrees of extension or straightening. So I'm going to go through some functional tests that you can perform to assess whether or not you're ready to return to run safely. 10 single leg calf raises. Five single leg squats on a 20 centimeter box or stair. In this case, my box is a little bit too big, so I need to go about half the distance, so I'm not going to lower my foot quite all the way down to the floor. You'll stand near the edge of the box, and the goal is to perform the movement, keeping your hips level and your knee over your ankle. Ten single leg hamstring bridges from a box or step stool or stair that's about 20 centimeters. Place your feet up on the box, lay onto your back. My toes are in the air. I'm going to be pressing up through my heels, just on one leg to raise my hip, aiming to get it level with my knee and shoulder. Ten single leg box squats. So you're going to use a surface that puts your knee angle at about 90 degrees for this movement. I like people to work up to about 1.25 their body weight in additional weight while they're doing the movement. So in this case, I'm adding a 30-pound dumbbell. You could also use 2 dumbbells or a barbell. Single leg hop test. So I'm going to need 3 pieces of tape for this. I'm going to place one where I'm going to start the test, so I have reference of where to come back. And then from here, from one leg, I'm going to jump as far as I can forward with good control, stick the landing, and I'll place the other piece of tape where my heel lands. I'm going to then repeat with my injured or non-dominant leg. I'll measure from the center of each piece of tape and compare my right to left leg, or my injured to uninjured or dominant to non-dominant leg. And the goal is to have the injured or non-dominant leg to be within 90% of what you scored for the other side. You can do a few trials of this as well to get an average. 10 single leg hops forwards and backwards, and 10 single leg hops side to side. I'm going to use just a line on the floor for reference of what I want to jump over, but you could also place a piece of tape on the ground.